9 warning signs your kidneys are failing. Tests to avoid dialysis. Kidney failure often develops gradually, with early signs sometimes being mistaken for other health issues. Recognizing these warning signs can help in preventing further damage and ensuring timely medical intervention. Here are 9 common warning signs that your kidneys may be failing. 1. Fatigue and weakness. One of the most common and early warning signs of kidney failure is chronic fatigue and weakness. The kidneys play a vital role in filtering waste products and toxins from the blood, maintaining the body's chemical balance. When they begin to fail, these waste products accumulate in the bloodstream, leading to a condition called uremia. Uremia is responsible for causing overwhelming fatigue and a general sense of weakness as the body struggles to manage the toxic buildup. In addition to the direct effects of uremia, kidney failure impairs the production of erythropoietin, a hormone responsible for the creation of red blood cells. When erythropoietin levels drop, fewer red blood cells are produced, leading to anemia, a condition that further compounds fatigue. Anemia from kidney failure not only causes weakness but also makes it harder for the body to transport oxygen to muscles and tissues, contributing to shortness of breath and sluggishness even during minimal physical activity. People experiencing this symptom may find it difficult to complete daily tasks they once found easy. They may notice that their energy levels drop significantly and feel exhausted even after sufficient rest. It can be frustrating and confusing, especially when the cause is not immediately apparent. The fatigue can affect both physical and mental well-being, making it harder to concentrate, remember things, and stay focused. Fatigue and weakness can also lead to emotional distress, as the constant lack of energy may prevent individuals from participating in activities they enjoy or fulfilling their work and family responsibilities. It's important not to dismiss this symptom, especially when it persists over time. While fatigue is a common symptom of various health issues, when it's combined with other signs like changes in urination or swelling, it could indicate that the kidneys are not functioning properly. Early detection of kidney failure can help slow its progression, and addressing the underlying cause of fatigue is essential for improving quality of life and kidney health. 2. Swelling, edema. Swelling, also known as edema, is another key warning sign of kidney failure and often appears in the legs, feet, ankles, hands, and even around the eyes. The kidneys are responsible for maintaining the body's fluid balance by removing excess water and sodium through urine. When kidney function declines, they lose the ability to properly filter and expel these excess fluids. As a result, fluids start to accumulate in various tissues, leading to visible swelling. Edema typically presents as puffiness or a sense of heaviness in the affected areas. The skin may feel tight, and pressing on the swollen areas might leave an indentation, known as pitting edema. This condition can be more pronounced after long periods of sitting or standing and can become progressively worse as kidney function continues to deteriorate. In some cases, the swelling may even make it difficult to wear shoes or jewelry due to the fluid retention. Aside from the visible signs, edema can cause discomfort and pain. Swollen legs and feet, for instance, may become achy and limit mobility. In more severe cases, the accumulation of fluid can lead to other complications, such as difficulty breathing if fluid starts building up in the lungs, a condition known as pulmonary edema. The underlying cause of swelling in kidney failure stems from the kidney's reduced ability to manage sodium and water levels. But other factors like decreased protein levels in the blood can also contribute. When albumin, a protein produced by the liver, decreases in the blood, it can lead to fluid leakage from the blood vessels into surrounding tissues, worsening the swelling. Swelling is often accompanied by other symptoms of kidney failure, such as changes in urination and high blood pressure. It's crucial to address this symptom early, as it not only indicates kidney problems but can also point to potential cardiovascular complications. Left untreated, chronic edema may contribute to skin ulcers, infections, and further strain on the heart and kidneys. 3. Changes in urination. One of the most telling signs of kidney failure is noticeable changes in urination patterns. Since the kidney's primary function is to filter waste and excess fluids from the blood, any decline in their ability to do so is often reflected in urine output. Changes can manifest in several ways, including increased or decreased frequency, alterations in the color or consistency of the urine, and the presence of blood or foam. People with failing kidneys may experience frequent urination, especially during the night, a condition known as nocturia. This can lead to disrupted sleep and fatigue, as the urge to urinate becomes more frequent. On the other hand, some individuals may notice a reduction in the amount of urine produced, even though they are consuming the same amount of fluids. This reduction is a sign that the kidneys are struggling to eliminate waste effectively, which can cause dangerous fluid retention. The appearance of urine can also change. Some individuals may notice that their urine becomes darker, often described as tea or cola colored. This can indicate the presence of blood, a condition known as hematuria, which occurs when the kidneys' filters, called glomeruli, are damaged. In contrast, urine may also appear foamy or bubbly, signaling the presence of protein, which should normally be retained in the bloodstream but leaks into the urine when the kidneys are failing. In some cases, urination may become painful, or people may experience a burning sensation, which could indicate an underlying infection or a blockage in the urinary tract. Kidney stones, infections, or an enlarged prostate may exacerbate these issues, and medical intervention is often required to manage them. Monitoring changes in urination is crucial for detecting early signs of kidney failure. While minor fluctuations in urination can occur for various reasons, persistent or severe changes should not be ignored. If other symptoms like fatigue, swelling, or high blood pressure are also present, it may indicate a more serious underlying issue with kidney function. 4. Shortness of breath. Shortness of breath, or difficulty breathing, can be a distressing symptom of kidney failure and often arises due to fluid retention and anemia. When the kidneys are unable to properly filter fluids and wastes from the blood, excess fluid can accumulate in various parts of the body, including the lungs. This condition, known as pulmonary edema, occurs when the lungs become overloaded with fluid, making it difficult to breathe normally. Fluid in the lungs may cause people to feel breathless during activities that wouldn't normally be strenuous, such as walking short distances or climbing stairs. In more severe cases, the shortness of breath may occur even while at rest or lying down, especially at night, when fluid tends to pool in the chest area. This can also lead to a frequent need to prop oneself up with pillows while sleeping, as lying flat worsens the sensation of breathlessness. Anemia, a common consequence of kidney failure, is another contributor to shortness of breath. Healthy kidneys produce erythropoietin, a hormone that stimulates the production of red blood cells. When kidney function declines, the production of erythropoietin decreases, leading to fewer red blood cells and, therefore, less oxygen being delivered to tissues and muscles. This oxygen deficit leaves individuals feeling fatigued and out of breath, even with minimal exertion. Shortness of breath due to kidney failure can also be linked to high blood pressure, another complication of impaired kidney function. When the kidneys are unable to regulate blood pressure effectively, the heart and blood vessels experience added strain, which can further contribute to respiratory difficulties. Recognizing shortness of breath as a potential symptom of kidney failure is essential for timely intervention. Left untreated, this condition can worsen, leading to complications like heart failure or severe lung problems. If accompanied by other signs of kidney failure, such as swelling or changes in urination, medical evaluation is crucial to determine the underlying cause and prevent further damage. 5. High blood pressure. High blood pressure, also known as hypertension, is both a cause and a significant warning sign of kidney failure. The kidneys and the circulatory system are closely linked, with the kidneys playing a critical role in regulating blood pressure by balancing sodium and water levels in the body. When kidney function declines, this balance is disrupted, leading to fluid retention, which increases the volume of blood and subsequently raises blood pressure. In kidney failure, the kidneys lose their ability to filter out excess sodium, causing the body to retain both sodium and water. This excess fluid in the blood vessels creates additional pressure, straining the heart and blood vessels, which can lead to hypertension. High blood pressure, in turn, further damages the kidneys by placing stress on the tiny blood vessels responsible for filtering the blood, creating a vicious cycle that accelerates kidney deterioration. People experiencing hypertension related to kidney failure may not always feel obvious symptoms, as high blood pressure can be a silent condition. However, some individuals may experience headaches, dizziness, or vision problems as their blood pressure rises. Severe or prolonged high blood pressure can also lead to complications such as heart disease, stroke, or damage to other organs. In some cases, kidney disease is diagnosed because a person seeks medical attention for high blood pressure. Blood pressure that remains high despite treatment with medication may suggest that the kidneys are not functioning correctly. Doctors may run tests to assess kidney function, including blood tests for creatinine and urea levels, as well as urine tests to check for the presence of protein, which can indicate kidney damage. Managing blood pressure is essential for protecting kidney health. Medications like angiotensin-converting enzyme (ACE) inhibitors or angiotensin II receptor blockers (ARBs) are commonly prescribed to control blood pressure and slow the progression of kidney damage. Lifestyle changes, including reducing sodium intake, increasing physical activity, and maintaining a healthy weight, are also crucial strategies for managing hypertension and supporting kidney function. 6. Persistent itching. Persistent itching, also known as pruritus, can be a troubling sign of kidney failure, as the kidneys lose their ability to filter waste products and toxins from the blood. These substances begin to accumulate in the body, leading to various complications, including skin problems. One of the most common dermatological symptoms in kidney failure is uremic pruritus, where the buildup of toxins causes intense and often widespread itching. This type of itching can affect the entire body but is often localized to areas such as the back, chest, arms, or legs. It can range from mild to severe and may be constant or intermittent. The sensation can be so intense that it disrupts sleep, affects concentration, and significantly impacts quality of life. In some cases, scratching can lead to skin damage, infections, or open sores, further complicating the condition. The exact cause of pruritus in kidney failure is not fully understood, but several factors contribute to its development. One major factor is the buildup of waste products such as urea, which irritates the skin. Another possible cause is an imbalance in electrolytes, particularly elevated levels of phosphorus. In advanced kidney disease, the kidneys are unable to remove excess phosphorus, leading to hyperphosphatemia, which has been linked to itching. Hormonal imbalances and inflammation may also play a role. Persistent itching may worsen as kidney function declines. particularly in those who require dialysis. The itching can sometimes become so severe that it leads to depression or anxiety, compounding the physical and emotional burden of kidney disease. While there is no cure for uremic pruritus, treatments are available to manage symptoms. These may include topical creams, antihistamines, or medications to reduce phosphorus levels in the blood. Moisturizing the skin regularly and avoiding harsh soaps can help alleviate some discomfort. Addressing the underlying kidney disease through appropriate medical care is essential for managing both the itching and other symptoms of kidney failure. 7. Nausea and vomiting. Nausea and vomiting are common symptoms of advanced kidney failure and can occur as a result of the body's inability to eliminate toxins and waste products. When kidney function declines, toxins such as urea and creatinine build up in the blood, leading to a condition known as uremia. Uremia affects various systems in the body, including the digestive system, causing nausea, vomiting, and loss of appetite. The nausea experienced in kidney failure can be chronic and severe, often leading to a significant reduction in food intake. This can result in malnutrition and unintentional weight loss, further weakening the body and contributing to feelings of fatigue. Vomiting, when it occurs, can be unpredictable and may happen after eating or drinking. This not only affects nutrition but also can lead to dehydration, which worsens kidney function. In some cases, nausea and vomiting are triggered by the treatment of kidney failure, such as medications or dialysis. Dialysis patients, in particular, may experience these symptoms due to changes in fluid and electrolyte balances during treatment. Dialysis is essential for removing toxins, but the body's response to the shifting levels of certain chemicals, such as potassium or sodium, can induce nausea. Another cause of nausea in kidney failure is the presence of metabolic acidosis, a condition in which the body produces too much acid or the kidneys cannot remove enough acid from the blood. This imbalance disrupts normal digestive functions, contributing to symptoms of nausea and vomiting. Managing nausea and vomiting in kidney failure requires a comprehensive approach. Physicians may prescribe medications to control nausea, such as antiemetics, while addressing the underlying causes of uremia and metabolic imbalances. It's crucial for patients to maintain adequate nutrition despite these symptoms, which may involve dietary modifications, supplements, or working with a dietitian. In severe cases, hospitalization may be necessary to correct dehydration and restore electrolyte balance. Early recognition of nausea and vomiting as warning signs of kidney failure can prompt timely medical intervention, improving outcomes and preventing further complications. 8. Metallic taste in mouth. A metallic taste in the mouth, medically referred to as dysgeusia, is a frequent but less commonly recognized warning sign of kidney failure. This unpleasant taste, often described as bitter or metallic, is caused by the accumulation of waste products in the bloodstream, particularly urea. When the kidneys are unable to filter out these toxins effectively, they begin to affect various body systems, including the taste buds and saliva. As kidney function declines, urea levels rise in the blood, and some of this urea is broken down in the saliva into ammonia, which creates the metallic taste sensation. This can be especially noticeable after eating protein-rich foods, which can intensify the flavor. For many individuals, this metallic taste leads to a reduced appetite or an aversion to certain foods, particularly meat and other proteins. In addition to the metallic taste, many people with kidney failure report having bad breath, often described as smelling like ammonia. This condition, known as uremic fetor, occurs when waste products are excreted through the lungs as well as the kidneys, creating an unpleasant odor in the breath. The impact of this symptom can be more than just uncomfortable. It often contributes to poor nutrition, People who experience dysgeusia may find themselves avoiding meals or only eating bland foods that don't trigger the metallic taste. Over time, this can lead to weight loss, malnutrition, and a lack of essential nutrients needed to maintain overall health, further exacerbating the symptoms of kidney failure. Managing the metallic taste involves addressing the root cause, kidney failure itself, through appropriate medical treatment, such as dialysis or medications to reduce urea levels in the blood. Some individuals find relief by maintaining good oral hygiene, chewing sugar-free gum, or using flavor-enhancing seasonings. Working with a dietitian can also help patients find nutritious foods that are more palatable and help mitigate the effects of dysgeusia. Recognizing dysgeusia as a symptom of kidney failure is important, as it often signals advanced stages of kidney disease and the need for prompt medical care. 9. Muscle cramps. Muscle cramps, especially those occurring in the legs, are a common and uncomfortable symptom of kidney failure. These cramps are often the result of imbalances in electrolytes, such as calcium, potassium, and phosphorus, which the kidneys normally regulate. When kidney function declines, the body struggles to maintain these electrolyte levels, leading to painful, involuntary muscle contractions. In kidney failure, calcium and phosphorus levels become particularly problematic. The kidneys are responsible for balancing these minerals. But when they fail, phosphorus tends to accumulate in the blood, while calcium levels drop. This imbalance can interfere with nerve function and muscle contraction, causing cramps. Low calcium levels also stimulate the parathyroid glands to release more parathyroid hormone, PTH, which further disrupts calcium metabolism and contributes to muscle cramping. Another cause of muscle cramps in kidney failure is dehydration, as the kidneys lose their ability to concentrate urine and manage fluid balance. Patients may experience excessive fluid loss or, conversely, fluid retention. Both of these states can lead to dehydration or an imbalance of electrolytes, which are necessary for normal muscle function. Additionally, reduced blood flow to the muscles, particularly during periods of physical exertion or at night, can trigger cramps. Dialysis patients are particularly prone to muscle cramps during or after treatment due to rapid fluid shifts and changes in electrolyte concentrations during dialysis. Muscle cramps associated with kidney failure can be debilitating, often interrupting sleep and causing significant discomfort. They may also lead to reduced mobility or avoidance of physical activities due to the fear of triggering cramps. Managing muscle cramps involves correcting the underlying electrolyte imbalances and staying well hydrated. Physicians may prescribe phosphate binders or calcium supplements to help balance mineral levels, while adjusting dialysis treatments to minimize fluid shifts. Stretching exercises, maintaining a healthy diet rich in electrolytes, and using muscle relaxants or other medications may also help alleviate cramping. Recognizing muscle cramps as a symptom of kidney failure is important for early intervention and management of both the cramps and the kidney disease itself.